Dr. Joy Anderson, Associate Professor of Obstetrics and Gynecology at the Permian Basin Texas Tech Health Science Center. You know, I'm here to talk about HPV vaccination, but I really don't like the name of the vaccine. It's a cancer vaccine. Let's call it what it is. It vaccinates against cervical cancer, penile cancer, probably some head and neck cancers, vulvar and vaginal cancer. These are cancers that affect my patients every day. In fact, I've had patients die from these cancers. This is something that's very important to vaccinate your children against. 8 out of 10 patients have HPV. In fact, they've done studies looking at OBGYN doctors. 100% of us have the virus because we catch it from our patients even though we wear gloves and wash our hands. It's an incredibly frightening virus to have. Most of the time, the ones that cause genital warts don't cause any cancer, and the ones that cause cancer don't cause genital warts. So unfortunately, you don't know that you have one of the bad strains of HPV until you have a bad pap smear or a precancerous change. Vaccinating is going to change the world with that. I strongly recommend the vaccine. There's no side effects to the vaccine other than it's a painful shot, but as I tell my teenage patients, wait until you see what happens when I do a bad pap smear treatment. Those aren't fun either, so I strongly recommend getting the vaccine. It's a series of 3 shots given over 6 months. We're not injecting the actual virus, we're injecting what we call a virus-like particle, which is very similar to a mug shot of the virus. It's not going to cause any harm. It does prevent any sort of cervical cancer in probably 95% of patients, probably 50% of head and neck cancers also, and probably 70 to 80% of vulvar and vaginal cancers. There's not really a reason to not get this vaccine. One of the things that really concerns me, particularly for serving on the Underserved Women Committee with ACOG, I really worry that some of my transgender patients or lesbian patients are going to bypass this vaccine. They're not going to think that they're at risk, but again, HPV can be spread by close contact and intimate touching. This is something that every patient should get. We stopped vaccinating at the age of 26 because everybody already has the virus. It's too late. I strongly urge this vaccine. Again, there's no situation where I would tell a patient not to get it. Thank you for listening.
Hello, I'm Bhargavi Kola, Vice Chair, Department of Pediatrics at Texas Tech Health Sciences Center, Permian Basin. Today, I'm going to talk about HPV vaccine as a pediatrician. HPV, also known as human papillomavirus, is known to cause genital warts and cervical cancer in women and anal cancer in men. About 6 million of our young women are infected every year, which includes teenagers with HPV, and about 4,000 deaths every year. Academy of Pediatrics highly recommends this vaccine. The youngest age we start vaccinating our kids is between 11 to 12 years, and this is recommended for both boys and girls. The reason why we recommend it at such a young age is at this age, the vaccine creates a best immune response. This is a life-saving vaccine, and I, as a pediatrician, want to create a strong future and prevent this cervical cancer and HPV infection forever from the United States. So please help us to protect our kids. Thank you.
Good morning, I'm Dr. Joe Kazor. I'm a clinical associate professor at Texas Tech and also a board-certified radiation oncologist. I was asked to talk this morning about the importance of the human papilloma virus vaccination. From a cancer doctor's perspective, it's very clear that the CDC or our national organizations suggest strongly that all boys and girls age 11 and 12 be vaccinated against the human papilloma virus. Our national organization called ASCO also strongly and clearly states the same. So why do cancer doctors feel so strongly that boys and girls, all boys and girls, should be vaccinated against human papillomavirus? The answer also is very clear. There's 5 cancers that are caused by this virus: cervix cancer, vaginal cancer, vulvar cancer, penile cancer, and oropharyngeal cancer. Another name for that, a layman's term, would be throat cancer. The basic concept is by vaccination, you can prevent the majority of all these cancers. By preventing these cancers, you can prevent the terrible things these cancers cause, the pain and suffering, and then ultimately the death of a lot of Americans from a preventable disease. So from a cancer doctor's perspective, it's very clear. There's no controversy. human papillomavirus kills by causing cancer. We can prevent this infection, we can prevent these cancers, and there's no medical reason why all boys and girls age 11 and 12 should not be vaccinated against this deadly virus in this country.
So the Pap smear is our primary screening tool for the prevention of cervix cancer. Pap smear came out around 1950, and before that time, cervix cancer deaths were one of the highest that we suffered in the female cancers. Since its introduction, the Pap smear has reduced cervix cancers to probably number 14 of all cancer deaths, so it's been extremely valuable and important. Pap smear is easy to obtain, it's generally well tolerated. Nowadays, the screening guidelines have become much more favorable in terms of the tolerance for our patients. Specifically, girls under 21, we don't Pap smear anymore, and those over 65 don't require Pap smears anymore either. So the grades, or the ages in between, are that of 21 to 29, where we recommend that they be papped every 3 years, and then those that are 30 to 65 are only needing PAPs every 5 years. So it's become much more tolerable, if you will, to our patients with that decreased frequency. So obviously, occasionally people are going to have abnormal Pap smears, and it's important for most women to remember that when we notify them that they've had an abnormal Pap, it does not mean they have cancer. The Pap's primary objective is to determine a precancerous lesion, which is one of its great utilities. We can determine and find precancerous changes long before they ever become cancer, and then activate and treat that to prevent cancer. Many times women can be very understandably concerned when they get a notification of an abnormal Pap, but I want to reassure that most of them, this is not a cancer diagnosis. There will be some things we need to do to confirm that and potentially treat. One of those, and the most common thing, is something we call a colposcopy. A colposcopy is simply where we are going to magnify the cervix with a special binocular, looking at the cervix to see if there are any lesions that correspond to the degree of the abnormal Pap that she had. Perhaps some biopsies may need to be done, and then with those findings we can determine what therapy she needs. But in most cases, these do not represent cancer. Our main goal here is to prevent cancer. So the most important message that I can send out to patients is, one, get your Pap smears as they're required. And when we do need to follow up with abnormals, please be compliant and come in for those visits. It's all about prevention, and that is our main goal.